What is the simplest taping technique DIY for plantar fascia pain? Hey everyone, my name is Deidré Bramble and I'm a registered podiatrist. I have treated many patients, from the elite athlete, aspiring athletes, children, dancers, and many more who have all suffered with chronic plantar heel pain. Are you still calling your plantar heel pain plantar fasciitis? And are you still suffering visiting practitioner after practitioner in hope that someone will be able to help you? What if it's not plantar fasciitis? Well, you're minutes away from understanding your plantar heel pain, and we're starting right now. Plantar heel pain occurs for two reasons. The first reason is your load may have increased. And what I mean by that is you may have started doing an activity that requires you to be on your feet for longer periods than usual. You may have started running instead of walking as part of your routine exercise, or your occupation requires you to stand for longer periods of time. I remember when I was at university and I took on a part-time job at a hospital as a patient services assistant. So that required me to be on my feet from 7 a.m. in the morning until 7 p.m. at night. Mind you, I lasted a couple of years without having any plantar heel pain, but then I also gained 2 kilos, which is extra load on top of all the activities that my job required me to do. So that didn't help. And then the second reason is that your capacity may have decreased. So you're not able to do any of the other things that I mentioned just now, but it means that it might be psychological. For example, you might be depressed, and if you are feeling depressed, then you are more prone to injury. Age is another contributing factor, and sometimes some hormones in our body can actually contribute to us having plantar heel pain. Some of the typical symptoms of plantar heel pain is pain first thing in the morning after long periods of rest, or if you haven't been on your feet for a long time and then you suddenly stand up. The other symptom is once you start walking, then the pain usually gets better. And finally, if someone tries to palpate the area or, try and find where is actually hurting you, then the pain is usually around the insertion of the plantar fascia going towards the arch. So this is the plantar fascia. It's a thick fibrous connective tissue that inserts from the heel bone here into the ball of the foot. And you can get heel pain along all these areas here. So from here, anywhere here, all the way down here is plantar heel pain. The job of the plantar fascia is to support the arch and to absorb shock. So when the heel hits the ground, it helps you to propel forward into your next step. Let's talk about some of the other reasons why plantar heel pain may occur. Number 1, fat pad atrophy. So basically the heel area doesn't have the same amount of fat that gives the foot the cushioning that it needs if you decide to increase your load. Females are mostly affected by this than men, and the older you are, you do lose the elasticity on certain areas of the foot, and also you lose some of the fat as well. Number 2, it could be neuropathic pain. So one of the nerves around the heel area may be compressed, causing, pain during the night. And 3, it could be a stress fracture, which is often accompanied by swelling and pain when resting. If you're learning something so far, put learning in the comments and let me know what you've learned. And whilst you're down there, give this video a thumbs up Subscribe to the channel. It costs you nothing, but it does help the channel to grow. And hit that notification bell so that you don't miss any of my videos. What is plantar fasciitis? Now, anything with itis at the end of it usually means that there's some sort of inflammation going on. But in 2003, Harvey Lemont and friends published an article saying that there's no inflammation on the fascia. Instead, it's more a degenerative process without the inflammation. So as you can see, research has evolved from since then. So practitioners are now moving away from the term plantar fasciitis and using plantar heel pain instead, although plantar fasciitis is still widely used amongst patients. Unless there's a specific reason for the healthcare practitioner to call the plantar heel pain something else, and this is usually after they've done further diagnostic tests because all the treatment has failed for the classic symptoms of plantar heel pain. So through those diagnostic tests, they'll be looking for other things such as bone marrow edema or fat pad atrophy. Now let me show you the simplest taping technique do-it-yourself for plantar fascia pain that I myself have used in the past. Okay, so let's talk about all the material that you need for your simple strapping technique that's going to support your arch. First, we have some scissors that we're going to use to cut all the material. Then we have some pre-tape or some protection for your skin in case you're allergic to the sports tape. So what we have here is some Me-Fix. This is some leftover Me-Fix that I have. It's a 10 centimeter roll. That is sufficient. Then we also have some foam under wrap, very thin. It feels like, you know, sponge that you find in pillows, very thin. You can use that if you can't get hold of Me-Fix. And then you have some Leuco tape. Now this is very, very strong tape. It doesn't stretch, it doesn't give. This is what's gonna really do the job. This is gonna support your arch. If you can see, if I try to pull, it's taking a lot of effort just to get a bit of tape off for me to use. That's how strong and supportive this is. So the Me-Fix and the foam under wrap, like I said, is just to act as protection for your skin. So if you're allergic to band-aids or plasters or anything like that, then this whole technique here is not for you because it's definitely going to cause some irritation to your skin. Once you have the tape on, if you see any redness or it starts to itch, then you want to take that tape off immediately. You can only keep this tape on for about 2 to 3 days. Some may keep it longer for 7 days if there's no issue, but for the most, 2 to 3 days is enough. So remember, the idea behind this strapping is to support your arch. And if this gives you some support, then this is an indication that you need some sort of inserts inside your shoes. So you can use something simple like off-the-shelf inserts, or you can go and see a podiatrist and get custom-made inserts. All right, let's apply the tape now. Okay, so make sure your feet are clean. Make sure you've washed them, dried them, and if you have any moisturizer on them, then you want to remove any excess oil because the tape won't stick. So what I have here is just some baby wipes, and I'm just going to wipe it to remove any excess oil to make sure that the tape sticks. And I've already prepared all the material that I need. So I've just cut a couple strips of the Me-Fix, just 2 will be enough. And then all I'm going to do now is remove the backing. And what you want to do is, so I don't have an arch. As you can see, my foot is quite flat. So flex your toe like this so that you can feel, the head of the metatarsal bone, which is right here. And then you just want to apply the tape just below there. So we're going to go here, just underneath, and then pull this tape up towards your body. So remember, this is not really doing anything. This is just to protect the skin from the Leuco tape that we're going to apply shortly. So then we get the second piece. I'm already making a mess. Doesn't matter if you overlap. So just stick and you pull up and over towards your body. And then now what we do, we get the strong tape. So the Leuco tape or the sports tape, whatever you prefer to call it. And then you start from the arch. And then you pull. So still keep your feet flexed. And you pull it up towards your body. And then you get the second piece and do the exact same thing. Like I said, it doesn't matter if you overlap. So you go on the arch and you pull up towards the body. And that's it. Simple strapping technique that you can do to support your arch if you have plantar heel pain. So now when I stand, it feels very supportive. As you can see, it's now created an arch for me that I didn't have before. So you start from the arch and you pull the tape up towards your body. So if you have pain, first thing in the morning, then this will definitely sort that out for you. And that's pretty much it. Okay, so I just want to show you a second technique. Now, this technique is creating extra cushioning around the heel area if the first technique didn't work. So around here, if you're feeling a lot of the pain around here, yes, the arch support may be sufficient, but sometimes for some people it's not enough. So you can try this technique that I'm about to show you. So remember, prepare the skin the same way. You want to apply your MeFix or foam under wrap first and then apply the strong tape. With the strong tape, you want to make sure the tape is a long piece. So make sure you cut quite a bit. This is about, so measure from here up to your calf, and that should be enough. So what you do is you feel where the heel is here, then slide your finger down. Where it starts to dip, that's where you want to start the wrap from. So as you can see, I rub my finger and it starts dipping here for me. So I'm going to start the tape from here. So you apply the tape there. And essentially what you do, make sure you pull. And you're basically going to wrap the tape around the heel. So you're wrapping it and you're pulling, you're bringing it up to the back of the heel. Pull, pull, pull. And come back. And just stick it there. Okay? And just smooth it out. So you wrap, wrap, wrap. And then you get a second piece. And then you go again. Remember, it doesn't matter if you overlap.
So you pull and you pull, you pull, you pull. Try not to bend the tape like me. And you pull and you push down. So what you can see here is kind of like, can you see how it's plumped up a bit? So it's giving you extra cushioning under here. And if this works, then you know that you need some extra cushioning under your heel. So you can get heel cushioning from the chemist, or you can buy trainers with extra cushioning at the heel area. Remember, if there's any redness or anything that appears, remove the tape immediately. Let me know how this goes for you.
If you're interested in reading the article that I mentioned earlier, I will leave the link in the description, and I will also pin it in the comments section. And I'll see you next time.